I want to thank the members of this committee and the staff for putting this agenda together. We've got one item on the agenda today. That's Senate Bill 265 by Senator Baroow. And with that, Senator Baroow, I'll let you kick us off.
Thank you.
Hold on one second. There you go. Wait, I got you.
Thank you, Mr. Chairman. And I also would like to thank you. I would like to thank the staff and the members of this wonderful committee that I've had the opportunity to serve on for 5 of my 6 terms going into. And so it has truly been an honor to have been a part of the Health and Welfare Committee. I certainly have a lot of knowledge as it relates to this issue because prior to this last term, this is the one committee that has remained a constant for me. And I have witnessed some of the things that I can say that I think that we've done well with the department. Like when we extended the age of those aging out of foster care, that was one of the things that to me was one of the most memorable things that we did to kind of bridge the support for kids who find themselves in the foster care system. But unfortunately, we've had, in my opinion, a lot more pitfalls than celebrations. And after a series of committee hearings during the interim, I've discovered that we have not made as much progress as I really would hope we would have. As a matter of fact, I've been quite disappointed in the lack of forward movement we have not had with the department. And so I'm going to start right here just to kind of give you guys a little bit more context of some of the issues. Many of you may remember a few years ago when we lost Mitchell Robertson, who lived in my district. And then a few weeks later, we lost another baby that was under 2. The situation with Mitchell was there had been 3 calls, well, it had been 2 calls prior to with the fentanyl. And then on the 3rd call, the baby did not survive. And unfortunately, we have continued to have those kind of stories where the department was aware, the department went out, had some level of response to the family, but at the end of the day, we still lost a baby. Before I got elected, I worked with a counselor. And that counselor would see children in the Department of Children and Family Services. I remember some of the cases that I saw. Senator Cloud. I remember Alicia, whose mom was on drugs. And the department had always said that their goal was always to reunify. So in their effort of trying to reunify, they went through a series of things, and this is what I actually witnessed as the administrator to the counselor. This was back in the 90s. And they tried really hard. And I can tell you the level of commitment that I saw with the department was pretty significant, but it was unsuccessful. I remember Sierra, Senator McMath, who was about 10, and her parents had put her in hot water. It was so hot that her skin actually came off. And why am I sharing this with you guys? I'm sharing it because I have been involved with this level of unfortunate situations and scenarios that happen to children who no fault of their own, to all my pro-life friends who were born into this world, who are in families, in situations that they do not choose, but yet things are happening to them. So when those things happen and we are made aware, then it's our responsibility to step in and stand in the gap, to assist those children who have no voice. The only voice that they will have is our voice. So, I am coming because in the hearing we had last week, I think, right, Senator Andrews? Was that last week? Yeah. The last question that I asked, and we had received a response saying that this had actually been addressed as it related to the call log and how calls were coming in and how those calls were being addressed. So the last question I asked was, last year in EBR, we have a call list that came in to DCFS where these calls were referred to law enforcement. You guys should have a copy of that on your desk.
I believe everyone does have a copy of this list. Yes.
It's 818 calls on that call list. And when you look, after it talks about agency, because DCFS is the agency, and then it has the allegations that have been called in, it talks about the jurisdiction of who actually should be responsible for the calls. 607 of them have a response. Not necessarily a response that is a good response, because some of it says not enough information. But some of them that will say which department was going to handle the investigation, BRPD, etc. But then it goes over, it says detective assigned, which is very few. And then when you get to a file number, which allows you to see how many of these cases were actually picked up, where there was some level of follow-through, there's only 74. That's less than 10%. So I asked the question, what had been done to address this matter right here, where we know from last year alone, just in EBR, how many calls that came in, how many of them went to the proper law enforcement office, and what was the follow-through, a follow-up. And when I asked the question, Senator, Chairman McMath, we heard crickets. Just before I came on the floor, Senator Fazy came to me and talked about a bill he passed back in '23, Ezekiel law. And he can speak more to that. But he shared with me, and the reason why he actually did the bill was to address communication, to address who picks the ball up, because in Ezekiel case, it had been a call, 2 weeks prior to law enforcement was supposed to get the baby. And they didn't get the call until the baby was dead. But we've been told that that is not even being adhered to at this point. I have brought this bill because the other thing I looked at was the finances. I've been reading social media posts and things that people have been saying, and why do we want to dismantle the department, and what do we plan to do? Well, I can tell you this, what we are doing now is not working. I can also tell you that since the Jindal administration, every governor that has came after him have tried to make this department whole. I can tell you from 2022 through this year how much money we have continued to give to the department, trying to make up for the shortfalls, and every time they have asked us for something, we have tried to answer. We have gone from, in 2022, over $211 million, 2023, and this is state general funds, $223 million. 2024, $258 million. And I can give y'all the total of what their total budget is for each year. 2025, $288 million. And this year, 2026, $321 million. So we can't say that they're not getting enough, that there's not substantial funding going to the department. I think that it is structurally broken. I believe, and I've asked civil service to assist me with how individuals are paid. I believe there are multiple layers to why this department is not functioning the way it can. And we can't keep doing the same thing, expecting different results. We keep putting more money in there, and we are still getting the same results. Right now, from last year, we had more than, I think it's 53 deaths, and of those deaths, 28 of those were deemed or substantiated as a result of abuse or neglect. But guys, already this year, and we are just in the month of March, we already have 12. And that was as of last week. This is not working. And so I am asking, I'm asking us to really do a deep dive to repair, because we can't not have a department. I know that much. But I am looking for options. I'm looking for, initially in my bill, I said that we would actually collapse it into LDH. But, you know, individuals have talked to me. I've gotten comments from folks about maybe collapsing it, some of it into revenue, because it talks about the collection component. I'm not going to even talk about the number of complaints I've gotten from non-custodial parents who oftentimes do not even find out that there's a child support that has been issued until they get ready to go do something, and then they find out that they have this ding where they have been not complying with paying child support when they didn't know they had to pay child support. Those go back to the communication issues and some of the structural issues. So some have talked to me about actually collapsing part of the department into the Attorney General. And so I am not taking any options off the table. I think everything should be considered. But what I do know is the way we operated, what has happened, the safety of our children, the welfare of families, it's not one that is moving in the right direction, and we have to change course now. We cannot afford to wait to the end of the year to try to figure out what we do next. We can't wait till next year. We can't wait till next month. And so with that, Mr. Chairman, I know I've received personally a lot of comments from individuals who told me they want to testify. I've received calls from individuals, from workers, who have shared their stories, what they have shared their experience. They have shared how this young lady drove all the way from up north to come and talk with me about what was happening in her division. And that's another, I shared with the secretary, I believe that this is multi-layered. There are some people who have been in this system so long that they do what they want to do, I believe. Now, I believe there are a lot of great people that work in that department. I have met some of them. But I believe that there are some people who are there who don't want to change. They are conditioned to what they've been used to doing. And if anyone comes to make any adjustments to what has been done, they reject them. And this young lady has been ostracized because she went against the grain of how the procedure should be done when a complaint was made, and has led to her nearly being dismissed. She was a whistleblower. And she is basically just going through the process of proving her case. But again, I have heard from multiple people, individuals who have sent testimonies to me about their children. I'm going to end with this, and I'm going to allow you guys to ask questions, and we can take additional testimony. Okay. So my daughter moved into a home in Zachary. My husband and I were very proud of her and excited. When she first moved into the neighborhood, it was a very new neighborhood and very few neighbors. So her next door neighbor came over and introduced herself to us, and we met that lovely family. Kind of fast forward, a couple years passed by, and the mother, the neighbor to my daughter, is a teacher who's married and husband works in a plant. Their child did not know this initially because she has participated in some of the youth programs that I have for technology, girls in technology. So when I filed the bill, the mother sent me a note because I didn't know this, but her child had ended up in DCFS custody. She shared with me that her child had severe mental illness and that the psychiatrist and the doctor had prescribed that she be in a facility where she would have 24-hour care. Just before I came in today, the mother sent me a note saying that they did not adhere to the doctor's prescription, and the child ended up in group homes. She'd been to multiple group homes. She ended up in a group home, and I'm assuming, I'm not quite sure because that wasn't clear, close to New Orleans. And as of today, she's missing. She's missing. So, for me, as I've watched, I've been doing this work, for over 30 years, working with young people. Mental illness is real. The severity of what families deal with now is more severe than it was 30 years ago. We know drug addiction is bad and it's real. But when kids are in these situations, and I have heard, see, we never hear about the kids that nearly die, right? We only hear when it's really bad and they pass. They need our help, and we cannot fail them, because when we do fail them, it may actually mean the death sentence for that child. And so I'm just asking that we truly look at how we address the failures of this department. And one thing to me that has been very consistent is the lack of communication. And Fessy, just like I said before I came here, shared with me the story about his bill. And we don't even know if we've had any hearings, but I think there should have been at least 6 or 8 by now to talk about how we fill that gap. We can't keep doing the same thing, expecting anything different. So with that, Mr. Chairman, I will stop.
Madam President Pro Tem, so first of all, I appreciate your service to your district in this state, as well as your many years on this committee. I know you're currently not serving on it, but I've been serving on this committee for 6 years, now. Had the honor of chairing it for the last 2, going on 3. You, myself, Senator Boudreaux, Senator Luno, Senator Henskins, all served on this committee last term under leadership of Chairman Mills, where we went through some pretty dark times in terms of a number of child deaths being reported. And under Senator Mills and your leadership, essentially helped the department triage and had countless oversight hearings and helped implement and fund a number of initiatives to try to stave off what was a series of tragic deaths from children, from the most vulnerable population. Yes. And what I think we can all agree on today is, and you hit the nail on the head, is we cannot fail the children of this state. It's particularly this vulnerable population. And while perhaps, dissolving the department, and you and I have spoke about this, is likely not the answer. What we can ensure, and you have my word as chairman of Senate Health and Welfare, is that we will do our best to continue to support the department and with the overall goal of supporting the children of the state. You have my word on that.
Thank you.
And while the testimony that we'll likely hear today will be tragic and difficult to hear, I would imagine, I would encourage every member of this committee and a member of the legislature to figure out the best way, and it's not just one answer. Look, this is an impossible job. Mm-hmm. It's the Department of Child and Family Services is unlike any other department that the state has in terms of perhaps building in efficiencies and finding savings and, doging your way to a solution is not the solution at all. In fact, this is, I think, the exception to the departments, and I'm talking about from LED to DOTD to LDH even, is that Department of Child and Family Services is completely different. And we have to recognize that and perhaps understand that there's not an actual solution itself. It's just continuing to provide the support as best we can as a state to ensure that we don't have tragic loss of life of our children. And so, I'm sure a number of members are going to want to share their thoughts. We do have the secretaries here. We appreciate any input that the members can provide, and obviously there's going to be questions, I would imagine, for the secretary as well. And so we'll let a couple of, there's actually, the board's lit up. We've got a couple of members that probably would like to say something, and then we'll take testimony. Senator Facey, you've obviously been invited to come and provide your input on Ezekiel's law and I think the failure that's taking place there. And so you'll have the opportunity to do that as well. But Senator Andrews, your number's lit up first.
Senator Baroow. Senator Baroow, first I want to thank you for your commitment. On last term, you chaired the Select Committee on Women and Children, and there was, in those 4 years, a mountain of testimony. I've often said this, and I will repeatedly say it in my time as chairman, that what I've seen with this department is that secretaries leave and everyone else stays. And generally, what we're finding, the deficiencies in the department are not duties that are performed by a secretary. And I think in past administrations, that has always been a fix. There's been a call to remove secretaries, and then secretaries are removed, and 6 months later, we'll still with this same thing. So that fix is not the fix. I think heavy is the head that wears the crown, but at the same time, that has just been an offset to silence legislators for a certain period. I do understand what you're saying. We've all experienced it with staff long-term staff who have been allowed to remain and not do their jobs. But this has been an overall systematic failure. And in my 13 or 14 years in the legislature, this has remained a systematic failure. However, what is true is that our children cannot keep falling at the hands of a department that we understand and know needs major change, period. Now, I believe Madam Secretary will be bold enough to make that change. We really did not, and I'll say this, be very strong about it, the reorganization didn't satisfy me. It does not denote that the changes being made is going to remedy the issues that have existed. I do believe that your bill, wherever it goes, however you change it, is going to be the catalyst to implement changes of legislators who sit in committee after committee with staff after staff, who've read emails after emails, Zooms after Zooms for years and years. This bill is needed. And I understand you saying that we know we cannot totally dismantle the department. But it is my hope that this department will work with you to bring a piece of legislation that will finally make the changes needed. Bottom line is that we cannot ignore it. Throughout this session, this legislation has to be the legislation that finally makes the change needed. I believe that government works best when legislators who serve their constituents, those constituents with issues, and those department heads sit at the table together, become very realistic about what's happening. The historical value of what has happened in this department, if you Google any news station, any newspaper in this state, you're going to see it. So we can't make the excuse anymore that we were not here. We don't understand the history. It is time for all of us to realize that something in this legislative session has to happen to make changes, period. I have asked Madam Secretary and the department to send over, and you were there, I think by March 31st is the deadline we put, a new budget. But I want to amend that request and say a new budget with what is contained in this bill. Because for me, I am joining you in this fight for this piece of legislation. And listening to you because you chair the Select Committee on Women and Children for a number of years. And you have seen, and we have seen what is happening to our children. Our children can no longer wait, period. We just can't. And we can put the blame game everywhere, but the truth is somewhere in that department, regardless of who has led it, has been a systematic failure that has continued to occur. So I am hoping your legislation will get to the weeds of that. I'm very hopeful that in your legislation, whatever reorganization, whatever rules you set up, whatever happens in that legislation will be applied. And that it will be something where we're not continuously coming back to the table with children dying and suffering. And that's where I am with it. I'm not going to take it lightly. We never have. But at some point, it is incumbent upon the administration to work with you, other legislators, and those who have become victims to this system and come up with a piece of legislation that works and a reorganization that really works. I understand, Madam Secretary, you all took a crack at it, but when we reviewed it, we had more calls coming in from staff and from others. I'm going to be very frank. I am still scheduling meetings because we end up having 100 and some calls when we had the meeting for the reorganization chart. So something has to be done. I am very prayerful that you and Senator Baroow will work together with our constituency. This bill for me doesn't disappear, but it takes on whatever you believe after meeting with everyone will work to save our children, period. And I am very supportive of this bill.
Thank you.
Because something has to happen because our children can no longer wait. Thank you, Mr. Chairman.
Thank you, Senator Andrews and Senator McMath, the Chairman McMath. I just want to say how much I appreciate y'all comments. And many of you have heard me say this before, that I believe that this department is the heart of state government. All the things that we do, and we do a lot of great things in this state, the most important thing that we do that can never be outsourced is what actually the value that we bring to the human life, to families, to children. And so our heart right now, I feel like it's on life support. Now, I do believe that, miracles happening and things can transpire. But, as you were speaking, Senator Andrews, because we have always been committed. Every person up here, I have served with many of you for many years, and people who have been before you. And I can tell you, I know you. I know that you're committed to this issue as much as I am. I know that. I can say that literally about every member in this body. But we got to make sure that once we pass it, that it's enforced and there's accountability back to us. And we shouldn't have to hold people's hand to be able to do that. There's a directive, and we expect that it's being responded to. So I welcome that, and I look forward to it, and I thank both of you.
Senator Boudreaux.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. Senator Baroow, let me just for a few minutes. I'm glad the chairman recognized the work that was started under Senator Mills, because this is always tough. Anytime we lose the life of anyone, especially our kids, is difficult. He also referenced the fact that, Senator Luno, you and I all were elected at the same time, and we served on this committee. You moved on to Madam Pro Tem, and Senator Luno and I have been on this committee for 11 years, so we've experienced it. And you also identified in your opening comments that we have some good employees in this department. Yeah. That came out of your mouth, and I don't want to lose sight of that. That while we've had some difficulties and we've had some disappointments, and while the progress visibly has not been what the expectation was set, we have some people in this department that, just like us, care. Yeah. And I don't want to lose sight of that. Yeah. I don't want to lose sight of those people who stay up at night worrying about those calls. I know you were instrumental when we brought Judge Ritchie on as the ombudsman to get some of the legal stuff. And we went through that whole last year with Senator Mills on this committee with hearings. And I, too, don't know what the answer is. I do know that we have to have DCFS on board. I know the employees in this department realize the calling. And so what I'll just throw out, as you said, we're going to have to do things differently. So, when we had those oversight hearings, we really had some momentum, because the employees came in and said, I was told I had to drive my own car, and that we didn't have pool vehicles, and we addressed that. We saw the vacancies, because there were vacancies in key positions that couldn't get to those families because we just didn't have them, and then it became a job or a position that was a lot of people just didn't want to take. And so civil service worked with us and increased some pay and looked at some duties and everything. So, I want to hear from people tonight, but I think we know what the problems are. I think what we need to get our arms around is, how do we continue? I think Senator Andrews just said it. The role of the secretary comes and goes with the governor most of the time. But does it mean we need to institute, just for this agency, an oversight committee that meets not quarterly, not monthly? I think we got to do something where, when you get reports like this, that's developed over a period of time, that we get of course, law enforcement, all the different stakeholders have to be a part of turning this around. And I'm just thinking, and again, the administration, from the governor's office on down, that we have to get a buy-in that this is just not something that we want to compile things, but that we see the results and we make those changes. And how do we get there? And just, when I got word yesterday that we were going to meet today, I know how important it is. But I'm thinking, that Mr. Chairman, we look at some type of ongoing ad hoc committee that does this. And I'm thinking, this can't be just when we in session or something that happens in the interim. This has to rise to a level where we have a representative from the governor's office. We have a representative. I know the chief of staff is here. Somebody that's going to sit at the table and we look at this. And if it's on a weekly basis, like you have staff meetings on a weekly basis, to provide those resources and law enforcement and on, attorney generals and all of this, because we know what the problem we see. And I'm like you, I don't know anybody in the agency that is at peace right now with where we're going. So that was just something I wanted to throw out, that maybe we look at this ad hoc that meets once a week, which is it's a big undertaking. But if we're going to address the issue, we got to hit it head on. And if we let time continue to roll, we're not going to be pleased with the outcome. So I know the DCFS has to remain in some structure, but I think we have to be intentional as to what it is we are going to change. And that's to provide more oversight, more direct oversight in addressing the issues, the deaths and the follow-ups and those things that you continue to get calls and everything on. So that's my opening in support of what you're doing. And yeah, I know, you got to ring the bell and you got to get everybody to understand that this is where we are. The time is now. This is not something that we keep putting off and say, well, it's going to get better, without making some substantial changes. So I'm committed. You have my support to let's work with the agency, work with the administration, work with the Attorney General's office, work with legislators to make sure that this remains a priority, and that in actuality, it never goes away. It's always going to be a priority, that this agency is funded properly and that it is effective and efficient in saving the lives of in this case, the kids. But as we do outreach with foster care, as we do outreach with adoptions, and just bring more awareness and more education to the legislative process. So that's my opening, and it's going to take some work. And I think, those of us who say we sign up for it, we need to put that action into, those words into action. Okay, thank you.
Thank you, Senator Boudreaux, and I appreciate those comments, and I welcome all the help and support, because at the end of the day, it is really about, for me, it's about the kids, right? But, you said a couple of things that really kind of stood out to me. And first, you talked about the administration, and I really believe every governor we've had since the one I mentioned earlier, has had a commitment to family and children. I know that our previous governor did. I know that this governor does. I know that. I know that without a shadow of a doubt. But what I also know is communication has continued to be one of those issues that seemingly keeps rising up. And I've had the opportunity, and I hate to say that, but I've witnessed where it has fallen, and it could have ended up bad had I not called. So I called and followed up with the department, and the ball had been dropped. Somebody did not call the parent to say, hey, the child is not going to go back. Those are the kind of things that to me are small, and that's hard to somewhat manage to some degree, but we have to have that commitment from the department, and the department has to demand the people that are working with them are following through and following those commands that they have in place.
Thank you, Senator Baroow. Senator Facey, you want to say a few words?
Thank you, Mr. Chairman. Back in 2023, I passed a bill that became Act 40 on August the 8th. The reason why I passed that bill, and I named it Ezekiel's Law, because Ezekiel was a little 2-year-old boy that was, his parents had separated, and his mama was keeping him with a boyfriend. And the daddy knew that this child was getting abused. It went on for weeks, went on for months. Finally, the little boy was supposed to be removed 2 weeks earlier before his death. The boyfriend and the mama had beat him to death and put him in a garbage can in my district. So for months after that, I started challenging where did we drop the ball? And Madam Secretary, I know you got a lot to go ahead of you to get this fixed. But what I found out working with staff and working with everybody and bringing everybody together, what I found out that all of the Child Services Department was never talking with the law enforcement. There was never no communications. I asked, had we ever met? Had we ever talked about who's not getting what, and who's getting this, and who's getting that? And the whole time, there was no communication. So we had meeting after meeting after meeting, and what we simply come up with is that every quarter to have everybody come together that's working with child services and law enforcement side, come together and put plans together on where are we missing the loop. So since then, we were supposed to have 9 to 10 meetings. Did we have any at all is my question. If we did, where's some of the results? What notes did we take? Maybe we can go back and re-put this together. But communications is everything. Wars get started over bad communications. We got to communicate. If law enforcement don't know what they're supposed to enforce or what they're supposed to do, and DCF don't know if they're doing it, that's where the failure's at. So we need to really work hard on getting our communication process. And I think Senator Baroow has really worked hard all of these years trying to just get communications going, because that's the fix. And then that way we can understand where we need to go. And all I'm saying is, if everybody knows what everybody's doing, it's a lot easier to do your job. So that's my take on it.
Secretary Harris, I'm going to ask you, you come down and take the table, and I'd like for you to address, one, I guess, any comments that you would like to address that you've heard so far, but in particular, Senator Facey's question as to the enforcement of Ezekiel's Law.
Yes.
Senator Facey, I'm going to turn you back on, okay?
Okay, good afternoon. So as to the quarterly meetings, we do have Rebecca Harris, Secretary for the Department of Children and Family Services. We do have the quarterly meetings still. What I will say is that they have not bubbled up actual solutions that can then be deployed across the entire state. So Assistant Secretary Connie Guillory, she is implementing new quarterly meetings that are more like blue sky meetings. So instead of just having meetings when there's something going on and we're solving that individual problem, they'll have these blue sky meetings that include not only our law enforcement, but also our superintendents in the education system, because they're the primary reporter to us for reports of abuse or neglect. It will also include our healthcare systems that are in that local area and our teams. And they will have a standing agenda that every group across the state will meet on the same exact agenda items to bring forth solutions that we can implement statewide. Because to the point that many of you are making here today, if we spend all of our time reacting to individual problems, we will never structurally change the department and actually improve outcomes for kids. So those meetings are kicking off, and we expect to have better outcomes as a result of them.
Well, I just like to thank you for having the meetings. I mean, I know, like I said, you're a newcomer into this. I just think that if you got nothing out of however many meetings we've had, then maybe we're discussing the wrong things at the meetings. And I see where you're coming from. So, I mean, the whole reason is to come up with solutions at any kind of meeting. Because, look, I know I hate to hear about meetings sometimes because we meet to meet. You know, and if you don't accomplish anything, why do you meet? And we just got to get a handle on it and make sure that we go with an agenda and you leave with a solution. And that's what I would like to see. Thank you.
Thank you, Senator Tracy. I guess Secretary Harris, what I'm not gonna ask. I'm going to strongly encourage you work not just with this committee, but directly with Senator Baroow. And there is a bill. It's a very, very, very large bill that is relative to all things DCFS. There's got to be a couple of low-hanging fruit items here that will help right the ship, I think, currently. And I will say Senator Boudreaux had a great idea on some sort of select committee on DCFS oversight that isn't just comprised of legislators. We need buy-in from a number of folks from the governor's office. State police has to be involved here. They have to be involved. Obviously, increasing pay for staff, which coupled with a higher requirement for employment within DCFS certainly could be some ideas. And then, like I said, forcing collaboration. And I hate to say that we have to force you guys to do anything, but we're at that point. I don't want to. I don't think anybody on this committee wants to. Senator Baroow certainly doesn't want to have to force you guys to do anything and do the right thing. It's particularly force you guys to follow existing law. But we're there. And then, I've heard some disturbing comments dealing with the ombudsman's office, and this may be true, it may not be true, but that they're perhaps running into some difficulty gathering information and having access to systems. Senator Baroow, you passed the law that created the Office of the Ombudsman. So you have this independent oversight over the department, and if they don't have full, unfettered access, it's pointless. And so if that is happening, that absolutely needs to change. We cannot allow the department to hide behind confidentiality, right? I mean, we have to be transparent as humanly possible here. And obviously, we deal with individuals and names are involved, and I certainly understand the need to protect children and protect names and protect parents. But the days of the department hiding behind confidentiality, that has to end. Transparency is going to solve this as we're all working together. We have, it's rare in state government that we have an opportunity for folks on both sides of the aisle, as well as different branches of government, all wanting to achieve the same goal, and that's to protect individuals' lives. Not to say that that's not your goal, but we're all trying to pull in the same direction, and transparency has to be key to that. It just does. So.
Understood. And we do have a standing monthly meeting with the ombudsman where we provide all information that's requested. So that's news to me that there's anything that's been requested that hasn't been provided.
Okay, and maybe it's not that they have to request information once a month. Maybe this is something that they just have open access to the system that is DCFS, and they can go in, if they have a question, they can go answer, they can go in looking for themselves and answer without having to have a monthly meeting. So there's some efficiencies that could take place. Senator Cloud?
Thank you. Thank you for being here, Secretary Harris. And we talked yesterday because I'm running a bill, and it's probably going to turn into 2 different bills. And the reason is because whenever we were discussing the bill that I'm going to be running, you mentioned another issue that is going on, and I found it to be pretty significant enough that we shouldn't wait until next legislative session. And you told me yesterday that you're making a running list. Like you're new at this. You're really you're diving in. And so you're making a list of, and checking it twice, of all the things that you know that we need to address legislatively where you find that your hands are tied statutorily. And so I would invite you, what you have found so far, you have a lot of willing participants here and throughout the legislature. Like, we don't have to wait until legislative session. If it is merit and it's justifiable and there's members that still have open bills, or it can be hitchhiked on to another bill, give us your list. Let's not wait, and let's start chipping away at it. I know, whenever they've come at restructuring other agencies, they've come up with a comprehensive way of attacking that. And I think Senator Barrow she's not trying to do it by herself. I think she wants to do it with your help, because you guys and your workers help throughout the agency, because you guys are the closest to the children and closest to the issues. What hasn't happened here, unless I haven't been paying attention well enough, you answered Senator Fazy with the Ezekiel's law, and I'm so glad that he passed that. And you've, kind of responded to a few different things, but what you haven't done is present your vision and some of the issues that you know that exist and how you plan to move DCFS forward. And I think we all need to hear that from you.
Yes, so to the points that y'all have made, it is an incredibly complex system, and it requires that we have partnership and collaboration from all of the stakeholders. That includes our schools, it includes our law enforcement, it includes our judiciary, it includes the healthcare system. Everybody plays a very critical role in what we do. And so when we look at it as an entire department, there are many things that need to be improved. What we have focused on over the past few months is just the basic structural parts, making sure that we have sufficient number of staff in the positions that we need them. The reorganization, I understand, Senator Andrews, that we had some concerns that have been brought up about that, but we did firmly believe that instead of having a significant surplus of staff supporting me in state office, that where we truly need people is on the front lines serving children and families. Coupled with that, whenever we overcompensated at state office, we pulled all of the talent, all of the expertise to our office, and it left the front lines, it left the local offices crippled with expertise. That's where we have to have it. And so we worked on that. We've worked on making sure that we have coverage that extends beyond the normal 8 to 4:30 hours, because we're not a bank. Anyone who intends to have ill will towards a child does not do it Monday through Friday, 8 to 4:30. It happens at all hours. So we extended to have coverage that covers those hours. We have worked on our call center. That is the first place where we receive reports, and we have to ensure that we have sufficient coverage, that we are taking the information necessary, and that we're dispatching someone out to respond to those children as immediately as possible. Dashboards is another issue. We experienced back in August of '24, I personally became involved in a investigation in a case. It was not my role. I was undersecretary at the the point in time. But when I started asking questions, what I found is that we had no dashboards. There was no visibility in what all cases we had across the state, where we were in the investigations, were we responding in the timelines that we were required to. And so we've implemented dashboards for investigations and timeliness. We've just implemented a dashboard for fatalities so that we can manage those. We're strengthening our partnerships with all of our stakeholders. Our hospital system is a main one. Women's Hospital, most of the births in Louisiana, 63 out of 64 parishes, they provide services to women. And we know at the point in time when moms are coming in, if mom's struggling or baby's struggling. And that's the point in time that we should be becoming involved, not waiting for there to be a crisis for DCFS to become involved. So we're making those investments early on. But what we are going to be focused on, the vision for the department, is that we have to focus on all four corners of home. The majority of our investment has been at the protection phase. It's too late in the game. That the abuse has already occurred, the neglect has already occurred. We have to spend more time focusing on prevention. We understand what the risk factors are that bring families into contact with us. It's poverty, it's addiction, it's mental health. We have got to have community-based resources. We have got to focus on prevention so that we can help families before the crisis arises. Preservation. Once families have come into contact with us, we have to identify, are there services that we can put into place for those families so that they can become stronger and the children can remain in their home? That's going to result in the least amount of trauma for a child. Protection is the place where we spend most of our time. We receive approximately 81,000 contacts to DCFS in any given year. About 25% of those are related to abuse and neglect. 25% of those are substantiated. It's a very small number, but those are the very critical, very tragic cases that we have got to root out. So we are making sure that our investigators are highly trained. We need to make sure that they are seen as public safety officials, just as fire, just as EMS, just as law enforcement. This past weekend, there was a situation that many of us probably saw on the news where there was gunfire exchanged. My team member was there. My team member was injured there. And so we have got to have the same respect for them that we have for every other public safety official in the state. They do work that many in this room could not do. It's impossible. And so we are going to make sure that we have tools that are available to them, that they can access case records, that they can report back information, that we have systems in place to where we know where they are in case they need assistance. And we're going to have better relationships with law enforcement so that they can have the support when they need it out in the field. The last place is going to be permanency. We have got to ensure that children that come into the custody of the state, that we work with our judicial system to make decisions swiftly. We can't have children linger in the system for years and years. It's their entire childhood that's left to the system. My longest waiting child has been in the system for 15 years, has spent his entire life in the system. And we have to do better in that area. When children can be reunified, we need to make that happen. When the parental rights are terminated and they are freed for adoption, we have about 300 children in the state of Louisiana. And I know with the population that we have in Louisiana, with the faith congregations, community congregations, the people around these children that already know them, that have relationships and love them, there's someone out there that can give permanency and home to these children. So I am supporting my team. I know that there's a lot weighing on my team right now. And I was asked at my all-staff meeting in Alexandria, one of my team members said, with everything that's going on right now and with this pending legislation, for those of us that are considering leaving, what would you tell us to make us stay? And what I say is that I'm a public servant. I have been a public servant for the last 20 plus years. I have dedicated my entire adult career to serving Louisiana citizens, and we do this not for the glory, not for the pay. It's because we believe in our communities. And so I have not given up on my team. I don't want my team to give up on themselves, and we are going to continue investing, and we are going to make sure that we provide better outcomes for children and families.
Very good. a couple of things. The dashboard is going to give you a view from home base at everything that's going on with every case, and hopefully it's set up like we've done. I hate to compare it to DOTD, but we just established from conversations like this, we established the project dashboard there so that we can see whenever cases aren't being moved or there's notations from the engineers or whoever's working on the case and what the holdups are. Is your dashboard going to flag those cases that are not being taken care of, that haven't been assigned a file number, that haven't been assigned an investigator? It's going to alert those that are in higher levels?
Absolutely. And we did, Senator McMath, we did bring a packet for each of you, if you allow that for your members.
Regarding the dashboard?
Yes, we brought you a draft of what it looks like so that you can have an idea of what we're looking at.
When did you put that in? I have a couple more. I know, Senator McMath, when did you put the dashboard, when did it come into play for your agency?
The fatalities dashboard is March 6th.
So, okay, this is the dashboard is comprehensive, but you're implementing it in segments, it
Yes,
sounds
and then
like?
there's the investigations dashboard that provides awareness and flags as it relates to investigations, investigation caseloads, timeliness to contact based on priority, which is dependent on what the priority is of the case, and when we need to make contact, it flags if that contact has been made so that those supervisors and leadership can follow up.
Okay.
That went into place last year.
Okay, well, we'll take a look at that. We might want to go through it together. Then I wrote down your injured team member. Your injured team member was responding to a call or a situation with a child in a home.
Yes.
Okay. And so your team member went out and there was a gunfire exchange. And so was your team member injured in the gunfire? What happened there?
Yes.
I mean, I want your team member to be recognized for responding and obviously being there to protect the child.
Yes,
So-
Shayla, yes.
Okay, tell us a little bit about that.
So I'm going to invite the Deputy Assistant Secretary, Ms. Leslie Lyons, because she coordinated the majority of this.
Okay.
Good evening. I'm Leslie Lyons. I'm the Deputy Assistant Secretary of the field offices. One of our staff it was our second shift staff. She was responding to a case where she had been out the evening before and visited the mother and the children, had some concerns, and was doing a follow-up. And when she arrived at the home, the mother wouldn't come to the door, so she contacted law enforcement. Law enforcement arrived. They couldn't get her to come to the door still, so they got another relative to come over to try to get her come out, and that relative was successful, but when she came out with a rifle.
Oh, my.
And was shooting directly at the worker and at the law enforcement officer. They had to take cover behind the police vehicle, and it was completely shot up. I mean, it was unbelievable. It took them a while to get the situation under control because she had fled into the woods with the children. They were able to take her into custody, and we were able to get the kids to the hospital as well as the worker, everyone to the hospital, and have them medically cleared. And that was a day in the life of a DCFS worker.
That is what things like that, the most horrific situations that they face.
Yes.
And there's not enough of them. So speaking to that, what is the ratio of DCF frontline workers to children? What is it, do you have 30 children to one worker? Like, how many cases are each worker managing on average?
So our average right now of CPS, just speaking to the Child Protective Services cases, that we have on average 10 cases per worker right now. Now, there are That's the average. There are many who are under that because they're new and they are not working a full caseload yet. And there are many there's a few dozen who are significantly over that because they're the more seasoned workers and they're carrying the burden while we get the new staff trained up. We don't have the number of kids per case, but we can get that information for you. We do know the number of children that we take into custody is typically 2 per case.
What does that mean, 2 per case?
There's, on average, 2 siblings per case that we're looking into.
Okay.
And so I would expect it to be somewhere around 20, if I had to guess. But we will find out those numbers and get that back to you.
Okay. So an agency can be fixed. Your agency is never going to be without problems because it's dealing with real people in really desperate situations. And but it can get better. And I know that you guys are making it. You're working hard to make it better. And we all want to help you. As Senator Baroow wants to help you, we all want to help you. I've watched with OJJ, which is never going to be a perfect situation because it's a lot of difficult situations. It's difficult, and I remember years ago when I was a brand new senator watching 6 secretaries, or maybe it was 5 at that time, just move through OJJ, one after another and after another. And I remember finally just sitting and looking at a secretary and saying, if you don't fix the foundation, if you don't fix the foundation, you're going to be another casualty, like another casualty as a secretary. And he was. It wasn't long. Months later, he was another casualty of a broken foundation. And I think that's what I'm hoping you're fixing is the foundation, so that we can move forward. But I'm looking forward to seeing the presentation on the dashboard. I think that's going to make a huge difference in what Senator Baroow and all of us heard at the committee hearing. If it's managed properly and implemented properly and expanded on, it'll send all the red flags that you need, and then it would just be basically DCFS negligence not to recognize them at that point. Am I correct?
Yes.
Yeah, okay. The legislation, all the different pieces of legislation that we can pass now, is there things we can do outside? I know you and I talked about 2 bills yesterday. Are there other things that you feel like are priority that we can help you with right now?
Yes, and I don't recall them off the top of my head, but we will make the list nicer because it's notes right now, but we will make the list nicer and we will reach out to y'all and see if anyone's interested on working any of it now.
Okay, we have a week, right, Senator McMath, week and a half to file some bills?
March 30th.
Okay, so let us know how we can help you.
Yes.
Thank you, Senator Cloud. Secretary Harris, before I turn it over, there's a few more folks that have questions. The response has to be nailed down first and foremost. You do a very good job of presenting and hitting all the talking points and the highlights and, the multi-pillars approach to reforming DCFS. But based on just testimony just last week, the call center employees haven't been fully trained yet. And I don't think that's going to take place until late May, early June. I believe there were 2 dates that were given, something like that. These are the frontline workers. These are the folks that, these are the ones that time is of the essence. They can save lives.
What I would clarify, they are fully trained under today's training model. There's no one in the call center who has not received training. What we are building out in Louisiana is a first of its kind child welfare telecommunicator training. And so to build and develop something that doesn't exist yet, that solves for problems that we have found in the call center, that will take time. And so that will be in May and June that they will receive that training. But there's no one in the call center today that hasn't been trained under today's training standards.
All right, fair. All right, Senator Luno.
Thank you, Mr. Chairman. Madam Secretary, I've been sitting here for 11 years listening to the problems of this agency, and it gets a little bit better and then it gets a lot worse. I don't need slick brochures to tell me what's going on with the agency. What I need somebody to tell me what the problems are so I can help fix that problem. For a long time, I thought it because y'all didn't have enough money and you couldn't hire people, and that may be some of it. But damn it, tell us what you need us to do to help you. Come in here and talking about how we're getting ready to approach this problem and do this model and that model. That doesn't help us any with today. We got kids dying now. I mean, this is enough. Do you know what this 213-page bill here represents? Frustration. I'm ready just to pass the bill, start over. It can't be any worse. So tell me, what can I do to help you?
What I would say is that, and look, I don't intend to pass a slick brochure. That's the only folders we had, but it gives you information for your individual districts, and those are some of the areas that you can help us. A home for every child, that's an area where we're looking to focus on permanency. There are some parishes in the state that have 0 homes available for children. And so when children come into custody, what a lot of states struggle with is that children end up sleeping in offices. Thankfully, we have not had that problem to the extent that other states have, but there have been times when a child has had to sleep into an office, and that's no home. And so we need to work within our individual communities to get more individuals to step up and raise their hand.
What have we done about that? What have we done in that regard to try to make that happen?
We're working with our community partners to do more meetings. I met with, in Pineville, I met with some teachers. We had a meeting last week in Livingston Parish with Principal Wax over there to talk to their teachers.
What came out of those meetings? What were the results?
We received information from them as to what prevents them from stepping forward to serve children in their local areas. What they told us is that they needed more information, kind of FAQs on what it actually looks like to serve children, and they also need more information on the timeline. So we're working with our teams to shorten that timeline.
I'll tell you the truth. I just assume they sleep in an office that's have to go to a home where somebody's going to beat them to death. I mean, it's that bad. I'm tired of sugarcoating this. I'm tired of having pleasant conversations in these meetings. I want something done. And if it means passing this bill and starting over, I'm ready to do it. And that's a drastic thing. We got to do better. I mean, I don't know what else to say. Thank you.
Thank you, Senator Luno. Senator Andrews.
Thank you, Mr. Chairman. I'm almost like Luno. When I first started this committee, I was like, let's work towards some resolve. But I'm just being honest, I'm sitting here now as I've listened to the back and forth and wondering whether there's no resolve. When was your first date at DCFS as secretary?
August
of
2025.
Okay, so you've been there almost a year. Did you propose any legislation this session, your department?
We did have 2. The first few months that I was in the secretary seat, the primary focus was on the One Door initiative and successfully moving all of our SNAP programs over to the Department of Health, and then all of our workforce programs to Louisiana Works. So October 1st is when we really started working on child welfare. We did put forth a couple of items. The majority of the work that we've been doing is actually within policy, because there's a lot of opportunity there.
What's your legislation? Because we know this is a problem, and I'm going to ask this: what is your legislation this session? What have you proposed as a department?
There's one on the child support enforcement side related to intercepting insurance proceeds whenever there's arrears, and the other is related to vehicles for youth that are aging out and are in the extended foster care program.
So nothing for the child welfare and safety was proposed. Your department, and this is where I'm going to get real, your department has brought no legislation, has asked no member to file legislation prior to pre-filing to deal with the problems we talked about in February in the Children Select Committee on Women and Children Committee.
That's fair. Yes, we have made substantial changes
I'm
within.
asking for legislation.
No.
So I hear Senator Cloud saying that you've talked to her the last couple of days regarding some bills. Senator Baroow introduced this legislation before we came in session. How many meetings have you and Senator Baroow had?
We've had a few meetings on different matters. I did call her after this legislation was filed to meet with her to understand what her goals and vision were.
Did you all meet?
Yes, we did.
Okay, Senator Baroow, because
We didn't meet. We talked on the phone.
you may want to come to the table, because you know how that is with testimony.
A phone conversation.
So when you understood her issues, her visions, her everything, did your department get busy with her crafting legislation? to address those issues? Because I can understand you met with Senator Cloud on some of these issues, right?
Well, yesterday was our
Right. Because it was coming to committee. And that's no fault of yours, it's no fault of any member, and that's the point I'm making. This was filed before this body came to session. And I'm asking just very pointedly, has anything been done since Senator Baroow filed this legislation? Have any suggestions been given to her? Has there been any roundtables with her or any of the senators before yesterday?
As it relates to this bill, no.
Okay. No. So she called me after the bill was filed, Senator Andrews. I want to make sure that I put this on the record. And she asked me that she noticed that in the bill that it only dealt with child welfare and child support, and that it appeared that we had left out another division, which is the administrative division, and was that the intent? She also implied and told me that if I needed any additional information, that she'd make herself available to speak with me, but there was no recommendations, there was no suggestions in terms of things that we could possibly do to address some of the concerns.
And this bill was filed, if I remember, after the Women and Children's Committee, the last one we had, not last week, but the one prior to
Right, correct.
that.
That's right, prior to that
So
one.
we talked about all the issues in that committee. Then Senator Baroow brings this bill. And as of date, DCFS has no legislation, no recommendations to the legislature to address any of the concerns that have been expounded on for months. That's kind of, I just assumed in my first comments that you and Senator have been working together. Honestly, that was my assumption, and I know what happens when you assume. I'm just going to say this because I know everyone has somewhere to be, but the children of this state need protection, so I'm here tonight, period. And I'm not going to shortcut my comments on it. I think it's really incumbent upon this department and this administration to work with Senator Baroow from now until pre-filing. If you do not want her to totally abolish this department, because I'm going to stand with her at the end of the day if after pre-filing nothing is there. Straight up, I am. That you work with her, you and your department and administration, to come up with legislation, an omnibus piece of legislation that she can bring before this committee. I cannot say that we haven't had enough time. This issue was not brought before, brought to DCFS at the time Senator Baroow pre-filed this bill. This has been a long-standing conversation. I took notes, understanding that you were working on some other initiatives. Your department, let me say that, and then October the 1st was when you guys began to work on this. But we've had 2 meetings with the Select Committee. The last meeting, and I know that you guys are talking about employees who are talking about leaving because this bill was introduced. But we have hundreds of employees who've called us that have been talking about leaving to the reorganization. Mm-hmm. So that's just kind of across the board right now. This bill didn't, maybe at the top levels, this bill may have, made employees uncomfortable. But I still have employees inboxing me on Facebook, emailing my office, even after having countless Zooms, who are looking for other employment. I just want to really encourage you all to work with the senator and bring some piece of omnibus legislation. How many bills you have left for post pre-file?
4.
She has 4 bills if they're not germane, but I think an omnibus DCFS bill is pretty germane. Unless she's going to create some other department or do something else. She has 4 bills. I know she's very dedicated to this. But this is, I'm gonna say we don't have time. I asked, I don't know if it was this meeting or Women and Children, because DCFS comes before both. I asked about the One Church, One Child Louisiana Family Initiative that was started. Really encouraged because that had 600 some or 700 and some adoptions on this last celebration with adoptive families from the prior administration. How are we doing on that?
The One Child, One Church, One Family, they do still have routine meetings, and we attend those meetings with them.
But we haven't heard much about that, and that was one of the most successful adoption programs that we had seen in all of our time here. And so is that not an initiative of the department still?
Yes, we are still working with them, and this is where I'd say we need our community members to come join in. The last couple meetings haven't had much attendance, and so we just encourage the community to keep stepping up for children.
Prior to, just an FYI, legislators were also asked if they had any churches or anyone want to participate to let the department know. Have you guys reached out to the legislative body? Or do you have a database of churches that were participating?
That were, or
That were participating in the initiative?
I believe that we do, yes.
Okay. Have you reached out to them? I know you don't do this personally, but who in your department works on those foster care adoption initiatives?
We have a recruiter in each region of the state. Another part of the reorganization is creating what we're calling Care Connections, and it puts together all the pieces and parts that brings families together that serve as foster homes, foster parents. And we are doing a faith challenge in with that, and so they're putting together the plans right now to re-engage and reignite the support from our faith community.
So is the faith challenge in conjunction with or something we've created?
It's in conjunction with. So all of those partners who have already been doing work, it's fragmented, and so we're bringing them all together so that we can learn best practices and create a force across the entire state.
I've been asking this because it seems like with every governor, we recreate the wheel. We never take what's working and keep it. Last I checked, we had 700 and some adoptions with families being celebrated by the previous administration. Why are we not working on that framework to build on it instead of doing separate initiatives?
The majority of the adoptions that have occurred are from families that have fostered children, and then once the parental rights are terminated, they then adopt the child. For children that are just freed for adoption, we are working with the faith community and also Wendy's Wonderful Kids, which is through the Dave Thomas Foundation, that helps with our hardest to recruit children. Those are primarily our teens.
But there was an initiative in place.
Yes, and we are reinforcing all of those.
But through a new program?
No, not through a new program. The way it was structured across the state is some of the services were provided in the field, some were in state office, some were in our legal department. It was all across the state, and so people were
I'm talking about our faith initiative, your faith-based initiative. It seems like you're working toward a new faith-based initiative.
I would not call it a new initiative. It's bringing it all together, learning best practices, reinforcing, and making sure that we're doing this statewide consistently. In the northern part of the state, in Shreveport, Caddo area, they do incredible work. They are very, very strong. There's other areas of the state where we're not so much, and so we need to learn and make sure that whatever's working well, we deploy that statewide.
Thank you, Madam Secretary. I'm going to reiterate this. If some omnibus bill doesn't come by Senator Baroow, hands of working with you, I'm going to co-author her bill. I am, and I'm going to hate to have to do that. But at some point, because of the children of this state, something needs to happen, and she has stepped up. We all had notice. We all were begging. And so I think the two of you can work together to get something done and get something to this legislature before March 30th filing deadline. Thank you.
Thank you, Senator Andrews. Secretary Harris, before I turn over to Senator Presley, I wasn't entirely sure where this meeting was going to go today in terms of action items, but I can tell you that we meet again next Wednesday. Actually, we meet again tomorrow, but after that, we meet on the 25th. Would like, between now and then, for you, Senator Baroow, Senator Cloud, whoever wants to participate in trying to come up with some meaningful legislation that can tackle some of the issues that we discussed today, and be ready to present those, or at least the idea of those. And when is the filing deadline? I'm sorry? 31st. Okay, so 2 weeks. There's obviously germane bills that currently exist that can be amended onto, or Senator Baroow, seems like you have a number of late files.
I do, but in addition to that, we can always, if we are able to come up with some meaningful language, can actually turn this bill into a substitute, right? It can become a substitute bill, and we can refile it under the new jurisdiction, right? But at the end of the day, as I've listened here and I've heard, and so I hear the secretary saying that, that she's willing and they wanted to work towards a meaningful solution, and that's what we're looking for. I think Luno said it best. This is as a result of frustration. This is a result of looking, and it appears we keep getting the same results. It's time out, because we have the life of individuals who they are paying for the lack of response with their life. And we cannot afford that any longer. And to Senator Cloud, she said something earlier that I do want to speak to. No department can be perfect, because none of us are perfect, right? There are going to be mistakes, but there are things that certainly can be minimized, and there are things that definitely can be addressed to make this a lot better. This is always going to be a work in progress. I shared with you guys my experience started 30 years ago, but guess what? Not one time do I ever recall us having a severe case with children under the age of 5. No, I take that back. There was one, 8-month-old, who actually was snapped in half by her mother. I remember that very vividly. But it was the only one. Most of the kids were above that age. They're getting younger, and the deaths are happening more frequently. So anyway, I'll stop right there. Thank you.
Senator Presley.
Secretary Harris, there are a lot of issues in this building that are partisan in nature. This is one that absolutely is not. It's a bipartisan call from this body and from our colleagues upstairs that absolutely want to solve this issue. What states are doing this right? What state do you look at and say, they're doing it right, and why haven't we copied it?
That's an excellent question. So that was one of my first questions when I stepped into this seat. And when you look from a national model and you say, tell me what state's doing it well and who do I need to follow, the unfortunate answer is no one.
Well, they got to be doing it better than us.
Not necessarily. Not necessarily. And so we have taken all the pieces of child welfare, so everything from centralized intake, adoption, foster care, all of the pieces, and we've said, okay, then tell me just this little piece, who's doing it really well. And then we meet with those states, we meet with anyone in the private industry that's doing it well, and we learn from them. That's why we're doing better in the call center. That's why we're doing better with dashboards so that we can understand what's happening.
I go back to what Senator Luno said. This 213 pages is a call to action to do it right. That's implementing ideas and concepts that other states have, whether that be in the rulemaking or the state lawmaking process. The fact that you couldn't tell us what are the 3 or 4 or 5 issues that that Senator Cloud asked you of what we can do really concerns me. And I get that it may be a note and scratch paper, but we've got to have that answer. And when you come back next week to this committee, I really hope that you have those concrete ideas that we can help with. I mean, Senator Luno spoke exactly the way that I think all of us are calling for, which is we want to help. We know that this is harming our children in the state right now, and we have to have the concepts. Y'all are subject matter experts in this field. You've got to help us to understand what are the concepts that you need that are concrete ideas that help improve the agency to the level that we can be proud of it. Because right now, DCFS, and I don't know who said this, I think it was Luno, said, I mean, it's a roller coaster. We do a little bit better and then we get bad again. We get a little bit better and then we do bad again. I mean, I remember sitting in health and welfare on the House side 4 or 5 or even 6 years ago, and Representative Hughes was talking about his concerns and his issues that he's seeing in New Orleans with DCFS. I mean, and he's a much better orator than I am, but it's clear that this is not something that we can just, have a shiny piece of paper, or we can just talk about at the desk. We need concrete ideas that are actually going to be implemented and actually affect the people of this state and these kids that have been harmed for too long by a broken system. Help us help you. Thank you.
I understand. And a lot of what needs to change in the department is related to practice. It's the procedures and it's the policy, and those are the things that we've been committed to changing in real time. For conversation's sake, to give you an idea of some of the things that we have on the list, which may create a little tension, I will go ahead and say, but things that we understand would have to be solved not from a policy, procedure, practice perspective, but would require some legislative change. Some of the risk that we see with children, where we know that they are at higher risk of coming into contact with us, is related to their school attendance. So if you look nationally and you look in Louisiana, children in homeschool are children that are often abused. And so there are states that have put forth legislation to say, hey, if there is an active investigation that prior to a child being removed from the educational system, which is, again, that's where our primary reports come from, it's our school system. They see these children all day, every day. They know their habits, they know their routines, they know what's normal. Once we receive a report, we see sometimes that those children are then removed from the school system and go to homeschool. And so we did have some conversation to see if there was any interest this year in doing legislation that would allow the department to intervene before a child is removed to homeschool. There was the ask for us to collect additional data, which we have committed to, and it's on the list for next legislative session.
Who asked you to collect that additional data?
Representative Carver is who we had met with on that.
He asked you to collect additional data?
Yes, to get the number of the children impacted so that we could write legislation that would actually work in Louisiana. The states that have attempted to do this before have failed, and so we want Louisiana to be successful in that area.
They failed, so that doesn't exist currently in other states?
I think there's one state that was successful in passing it. I want to say it was Tennessee, but I'll have to verify that.
Okay. Yeah, that's the excuse me. That's the type of information that we want to know about. That right there.
Yes,
and to Senator Presley's point, I mean, one of the beautiful things about this country is there's 49 other experiments going on, and we can pull from best practices from those other 49 states. Mm-hmm. And certainly there has to be at least one that's doing it better than we are. Representative Edmondson, you want to say a few words?
We're just looking. There's a lot of, can you hear me?
Yep, there you go.
There's a lot of information about other states. He just pulled it up, and all kinds of information. So I would encourage y'all to look at what other states are doing. The other thing I want to encourage is kind of to piggyback off of Senator Presley. We've got to think out of the box, because we're killing our children. And that's the only reason I'm here, is because of our children. And I have had so many reports over the years of things that needed to be changed. And you know what? The people that have called me, which is just the general public, they have great ideas. So I'm going to encourage you and your department to welcome. I don't know how you can do it. For one thing, his legislation has a commission, and we were looking at the makeup, and there's no general public. When you get the general public involved, it seems like things turn around quickly. So I would just encourage you to figure out ways that you can bring in the public, because they really do have good recommendations, and a lot of them have gone through it, and they know how to change things, and they're great for each other to be able to bounce things off of, and they've told me, and they just sound really good. So just to encourage you to do it. I know you have a hard job, but I can't even imagine. But like everybody, I echo every single one of us up here. We've got to do something. We've got to do something. Thank you.
I agree.
Okay. We do have two people here that would wish to have taken the time out of, I think, would be short notice in their day to come and testify. So let's have them up. George Mills. And these are, we don't have any other cards. All right. These are red cards, folks that are wishing to testify. George Mills and Paula Collins. Y'all want to come up together? All right, Mr. Mills, welcome to Senate Health and Welfare.
Yeah, thank you, Mr. Chairman. Thank you, committee members. My name is George Mills. I'm the executive director of the Extra Mile. I'm also the chairman of the Louisiana Behavioral Health Advisory Council. And I sit on a bunch of other stuff too, but we provide services in Region 4, Region 5, Region 6. A plethora of services. I do crisis response services. We do residential services for pregnant women, independent children. For the department, we do intercept services, home builders services, family resource.
You work very closely with the Department of Child and Family Services.
Yes, we do. We're the on-the-ground people in a lot of these things. We also train all the peer support specialists, family peer support specialists, parent partners for the
How long have
department.
you had an agreement or a contract with DCFS?
The contracts with DCFS goes back to the late 90s, I think was the first one, because we were one of the first family resource centers. Those services have evolved and changed with secretaries, governors,
Sure.
legislation over the years and stuff. And I just wanted to come and talk because, and I've known Senator Baroow for years, highly respect her. But just when I just glanced through and read through the legislation, as it sits, it concerned me. And the reason for that is because when I read the legislation, it basically said we're going to collapse DCFS and put it into Louisiana Department of Health. And after communicating with the Louisiana Department of Health, they were kind of taking a non-opinion on it, which from my history, because I do stuff with OBH and LDH too, that's kind of means they're not ready to or don't want to do something like that at this time. I'm not speaking for them, but
Yeah, I don't know if you could jump to that conclusion, but
that's just the information I had. I can say this, in all the years I've been providing behavioral health services and different services in the state for the last 30 years, all levels of care, off and on with DCFS, OBH. There is some good stuff that is starting to happen at DCFS. I mean, the elephant in the room with DCFS is a couple of the senators talked about problems with staffing and stuff over there. You have something like civil service you have to deal with. That's not always good. With my agency, if we have problems with individuals, they don't work there anymore because they have to be child first, family first, and do the things that are necessary. Now that we're talking about restructuring that bill stuff, I would reserve the ability to, have a different opinion of it. I just have from, it's brought to my attention. I saw Senator Barrow's little video on Facebook that was posted, and again, the stuff, I know the effects that the last year's legislation had with some of the stuff that when we start moving things around and doing things too, it also creates a lot of confusion and other stuff. And I'm here to help people. That's what we do. We help people. We help children. The rural areas of the state are a mess. transportation-wise, getting people, getting them services. Most, I would just suggest, because I know the state is really good at starting committees to look at stuff, but they don't get the people that are actually doing the services on the ground in those committees. They get academics, they get legislators, they get executive directors.
Yeah, we've actually had a fair amount of input from individual caseworkers, all confidentially, because out of fear of, retribution. So I would just so you know, we do get a fair amount of input from individuals. Are they serving on public bodies where they're having to be somewhat critical, or not just somewhat critical, but critical of their bosses? Yeah, no, probably not. But I think you can understand the reason why that may be. So,
Again,
if it does make you feel any better at all, that we hear a lot of information from the boots on the ground, as you'd say, you can rest assured that that's the case.
Okay. Well, again, it is my concern that, that we need to do a better job, again, of helping children in this community. That's where we all agree on.
Yeah, 100%. And I think that's the frustration, is where everyone's got the same goal. It's how do we get there? So.
Okay.
Yeah.
Well, I will be back as this revolves. I think Senator Baroow knows that I will be more than willing to, as I've always been, to work with her on anything. I think some of this stuff might help with the perspective of what on-the-ground service delivery looks like, and the prevention pieces, and actually helping the families that we're talking about. Like I said, we do a lot of services in this state that I know DCFS understands it, and OBH and the departments understand it, but I don't think a lot of other people understand that. And those services are highly, highly needed, and I can't stress that enough.
Yeah. Well, Mr. Mills, if you can figure out or come up with some suggestions between now and next week as to some potential legislative changes that could help you and help all of us protect children, we'd be more than welcome and would appreciative of that input.
Oh, yeah, I can help with that.
Okay, great.
Okay.
Thank you.
Thank you.
Ms. Collins?
Yes, can you hear me?
Yes, ma'am.
I am,
You go ahead.
I reside in Senator Barrow's district, and I have been affiliated with DCFS and retired from the Louisiana Workforce Commission. Children dying from abuse is never acceptable. So when I say what I'm saying it on behalf of how I honestly feel about going forth with this. I speak in opposition to this because shuffling the deck of cards doesn't change the cards themselves. It's just removing them from one place to the next. I went through as much of the 213 pages as I could. But what I understand from being on the inside of both of those agencies is that the capacity that's necessary to make the changes that will ensure that our children are taken care of does not currently exist. To me, the biggest flaw is that these positions are political appointments. And when you are politically appointed to a position versus being elected by your peers or versus having the authority to make the necessary changes without having to sometimes bend the knee, you create more of a problem than there could be. This current secretary, who I don't know, has only been on the job 6 months. There was one that was there before her. I worked tirelessly under contract trying to get social service workers hired based on my experience from the Louisiana Workforce Commission
in my past employment. I know that what we see going in isn't always easy. As there was mentioned, an incident with an employee, you'll always have life circumstances that happen. But I think the failure would come with thinking that you can transfer this to other agencies and it be resolved. I am as frustrated every time I see something like that on the news where a child is injured, a case wasn't handled, and honestly, Ms. Harris may be correct in her assessment, but I don't think that each CPS worker only has 10 cases and that others who've been around have more. Because what I experienced and what I heard from staff during that time was case overload. So how do we fix that? I also personally see the disconnect in the street, whereas there's no division in state police that handles child welfare. There are no social workers there. Someone mentioned an ad hoc committee meeting. You having an ad hoc committee meeting with principal employees will never get you to where you want to be. You need not only boots on the ground, but you have to hear what the boots on the ground are saying. Senator Andrews mentioned that she has collected calls and texts. Senator Baroow, she collects calls and texts. Well, I am not opposed to Senator Baroow at all. I am in opposition because I know this only shifts it out further. And my concern is, at the end of the day, who will see the kids? So my only suggestion as I leave here today is that you quit putting people in positions that make them incompetent because they don't have what it takes to succeed. And just giving a person a job or a title when you deal with children, it should be the ministry of children. And so not having what it takes to succeed will always lead to failure. So I'm not against this bill because of a personal reason with you, Senator, because I've watched Senator Baroow from a distance, always advocating on behalf of children. I hear what you say. I'm listening to you guys. But mark my word, dissolving it, dismantling it, and spreading pieces across the state will not resolve what's happening with our children, and they will continue to die.
Thank you, Ms. Collins. Senator Baroow, you want to come back to the table? Senator Andrews, you got a comment?
Thank you. I think I forgot. Oh, I noticed some people's face kind of looked strange when he said he only had 2 people to speak. I wanted to make sure because you've sat and waited. Yeah. Did you fill out cards and we don't have your card? White card.
A white card.
Okay.
This one says we'll provide information if requested. Would you like to come speak? Yeah. Oh, I'm sorry. I got you at the bottom there. My bad. Come on. Please, forgive me.
Nice to meet you, Senator McMath.
Yes, nice to meet you.
You are my representative for where I live. I've lived in the Mandeville, Covington area for 18 years.
Well, welcome to Senate Health and Welfare.
Yeah. I am a nurse practitioner. I have a doctorate in nursing. I am an evidence-based practice practitioner. I trained at Mayo Clinic. I was at the top of my class, and I worked for Dr. John Bolton at Ochsner as his nurse practitioner. So he was the chief of surgery of all of the hospitals. Throughout my career, I developed protocols, clinical pathways, and then I went on to work with UMC and become the manager of clinical research quality. So when I tell you that I have experience in these sorts of things and protocols and how you go about doing things, it's real life world experience. I first started to speak out a while ago. And the reason why I chose to speak out was because there was a child that I knew, very close to me. And this child was living in my house for almost 2 years. And we had custody of her. When she was 18 months old, she first showed signs of being sexually assaulted by her father. We reported it appropriately through her pediatrician. I was the mandatory reporter. I didn't actually file a mandatory report at the time. We went to Audrey Hepburn. They did a great job, and they unfortunately couldn't find physical signs of penetration, but all of the signs of child sexual abuse were there. Over the course, so this started when the child was 18 months old. She is now 7. Over the course of her lifetime, she has shown every single sign of child sexual abuse that there is. I personally saw signs of penetration in February of 2022. I didn't know what it was at the time because guess what? Nurse practitioners and doctors are not taught what those signs are, believe it or not. All I knew was that this was an incredibly unusual pattern. Didn't know what it was, but what I did do is I contacted people that I knew. So my mother, just to tell you, is an expert on child sexual abuse. She wrote protocols 45 years ago in my home province. I'm originally Canadian. I'm an American citizen now. All along, we have had contact with police and very, very slim contact with DCFS. So I've reported that. The first time at 18 months, the perpetrator didn't want to come in and see police. And police rely on, in order to bring it to the court, physical evidence, and the child has to disclose. If anybody knows anything about child sexual abuse, that's very rare. So about 90% of children, even with penetration, even with severe abuse, do not show any signs afterwards. Also, if you have a 3-year-old or a 2-year-old who's been abused and have no words to be able to say it, how do you prove that, right? Well, I can tell you, Senator McMath, there are places, because over the last few years, we have been in and out of court trying to protect this child because DCFS and police are incapable of protecting the child. Every time that I've had contact with DCFS, I have cleared it through experts, SANE nurses, and I am actually now going and taking SANE training as a nurse practitioner because our state really needs help. Yes. So, all along, I've spent over $300,000, my husband and I, in legal fees. We have been dragged into court by the perpetrator after we attempted to obtain custody to protect her. And police and courts have shown there's been evidence where they have helped the perpetrator get away with it. When we went to get custody of the child, it was shortly after the parent died. I once again saw signs of penetration. The child then was telling us that her daddy was hitting her, spanking her in between the legs. So you can imagine what she thought it was. I didn't understand. We filed for a custody, and it was granted. This is in St. Tammany Parish. The police didn't follow any protocols. So what police allowed the perpetrator to do is the perpetrator disappeared with the child for a bit in his home parish when we went to pick her up. He then blocked us from being able to see her, and when we filed the ex parte, what happened was police refused to help us go get the child, and the family brought the child to Hope House 2 days later. The person who brought the child was not DCFS. That person was the other father of the perpetrator. When we took custody, at no point, I spoke with police. Police definitely believed us because we're prominent people in our community. Until there was some point where all of a sudden police didn't want to talk to us anywhere. It was talk to the hand. The lawyers that we have dealt with and judges know almost nothing with respect to child sexual abuse. And so when Ms. Collins talks about how we have people that are put in positions of importance, they're not offered any training. So the stuff that comes out at court, people don't recognize the difference between indirect disclosures or direct disclosures, and all of this stuff gets put to the side. So all the way along, in July of that year, when the child was 3.5, we had her for a period of time, and once again, she disclosed something to us. She disclosed that her father was getting her into bed and kissing her in between her legs. And she got naked and invited me to get into bed naked. Our son heard it. She said that when I asked her if he was hurting her, she said it tickled. There is nobody who knows anything about child sexual abuse who says, well, that child's making it up. She can't possibly. How would she know that unless it's happening? So when we got back with the child, I went to, called DCFS. They told us to go out to the parish to go and file a report. We did. And we filed, and I spoke to police. Nobody from DCFS ever called us. There were collaterals that actually had called in. We've had, throughout the course of the child's life, we know of at least 13 or 14 mandatory reporters who have made reports. The perpetrator continually tells the court that it's only me and I'm orchestrating everything, which is patently untrue. And the perpetrator also has a ton of information that's confidential. How he knows it, I have an idea. What we discovered, so as we were going along, the child was still disclosing. He was taking us to court. We were having our visitation removed from us because I was reporting. I had the judge put a gag order on me and then put because I was reporting, and nothing was happening. He kept claiming that there was no proof that the investigations were completed and fully completed, which they weren't. And I started to look at okay, nobody is following any protocols. So I went looking for protocols. The Department of Justice has a protocol for child sexual abuse, and that protocol tells you how you're supposed to roll it out. In each case, except in Mandeville, Carol Muller ran a great investigation, but in each case, nobody followed the protocol. There was no forensic medical exam of the child. There was questionable. I kept questioning why is this child still disclosing? There was no trauma evaluation apparent. I'm going to fast forward through this. We went through 3 years of hell watching this poor child, disclosing to us over and over and over again, and we were supervised by someone who was not qualified. The child showed indirect evidence of severe emotional trauma. She's disclosed to me since. And when we went to court, so we finally went to court in St. Tammany. And what the lawyers did is they requested, so this person is saying that everything's been investigated, it's just me. So we requested the records to go to the court, which is what they're supposed to do. You know what showed up at the court? Nothing. This child has had contact with DCFS since the very beginning. So she was born drug exposed. I have her medical records. I have the mandatory reports. My own mandatory reports didn't even show up. So we're talking 6 years of information. The court got maybe about 16 pages, and they were from that particular parish and seemed to be prejudicial to me. I'm going to borrow this because I get very dry. Personally. The judge continued on, took 5 months to make a decision when she was supposed to do it in 1. And her decision was to continue on with 4-hour supervised visits and weekly. So basically, I was still gagged. We were supposed to be, all the way along, we said, well, look, if the child is traumatized, if we're causing any of this, let's send her to play therapy. He wouldn't send her to play therapy. He wouldn't agree to anything like that. When we finally got, the night before we went to court, when we finally got that record, it came from him. It didn't come from the police department. His father is a local politician, and his grandfather was in the same role for 40 years. The police, the sheriff of that particular parish is his family member. His aunt is married to his uncle. I'll just go on. So there's definitely been some leakage. And when I got handed the records are falsified. I can tell you that 100% for sure. How do I know that? Well, DCFS had already told me that Tony Buxton had told me that they didn't have protocols before. I have sat, and Steve and I have sat in front of the current administration and told them that these are falsified records. And they indeed are. I went to the FBI a couple of times and suggested to them, this is how this is being investigated. I would suggest there's something really wrong here. These are falsified records. First of all, he's not supposed to have them. Only the court's supposed to have them. What he had was a forensic interview form from the Baton Rouge Children's Advocacy Center. He's not supposed to have that at all. And when you look at the records, what I did was I did an audit. There's 53 different anomalies on that record. When I went to the FBI first said to me, thank you for coming and giving us this information. And you be careful now. That was very courageous of you to do. I went back again and I said, you're not doing anything. I had more information because what a lot of people don't realize is that I have a fraud investigation background from my time at the bank in Ontario, Canada. So I did my own digging and I went back and I spoke with them and they said, yeah, there's an easier way to tell if these records are falsified. So the agent told me a couple of things and I went, that's how it's falsified. I went back and I started going back to public records. The public records that were filed under that police incident number did not match what was on the police records that he presented. There was another police incident number that was on the Baton Rouge Children's Advocacy Center. That was a completely different incident number. The child was not evaluated for trauma. How do I know the child was not evaluated for trauma? Because on the form it said the PTS system is down. The PTS system is the pediatric trauma scale. She was 3 when this happened. It's only validated in 6-year-olds. So there are these records. I know I have copies of my report. I have the numbers. Nobody's been able to explain why these records have disappeared. So I hired some private investigators. They went down to the courthouse and they attempted to pull the records, the police records. Guess what, folks? It doesn't exist. There has never, since the child was 3, there has never been an investigation of any kind into the perpetrator in that parish. So that's a felony. I've reported it, and so we have proof now. I've reported it to a number of people. Nobody's doing anything about it because what it implies is some very serious stuff. And I'm telling you right now, I'm scared shitless. Absolutely terrified to be sitting here telling you this, because what it means is I'm taking on a whole police department, 2 courts. I've spoken to a DA, and I went out with my private investigators out and spoke to the assistant district attorney in that parish. She said, I told her what happened. She said, that's not possible. I said, it is absolutely possible. So in a room full of people, she pulled up his record and she said, oh my God, there is never, you're right, that's a falsified record. The number that was on the Baton Rouge Children's Advocacy Center record was of a completely different perpetrator out of Ventress, Louisiana. So what he had done is he had obtained police records, altered police records, falsified them, submitted them to the court in St. Tammany to say, oh yes, this was completely investigated. Guess what? Wasn't at all. The assistant district attorney was floored. She showed me his file. She turned it around. She said, you're absolutely right. And she said, can I take this? So she's now, I was going to hire her as an attorney. She said, I can't take this now. This is conflict. I said, I know that. She said, can I take it to the DA? I said, absolutely, but I'm telling you right now, the DA is a longtime friend of this politician. He's been covering up, so I have evidence that he's been covering up this guy's bad behavior. He was arrested in 2009 in East Baton Rouge for drugs. They found him with his pants down around his ankles at LSU with pockets full of drugs. No charges. This guy has been protected because he's politically connected. Now, what I'm telling you is that our DCFS, Ms. Rebecca Harris and the entire team of DCFS were informed of this. Absolutely. I told them. They promised they were going to investigate. They all know that there was no interview done at the Baton Rouge Children's Advocacy Center. It's not possible. Nothing has been done. It's been a year. Fast forward, the same child, we see her, we haven't seen her, by the way, since December, because her dad, the perpetrator decided that we were beating up on him. He knew everything about us, everything that we had reported to DCFS. He even knew when our private investigator went to the courthouse because he threatened us. So people within the courthouse are telling the politician when we're there, what we're doing, and there's been information released that he's publicly said and put in writing to the court that it's not possible for him to know except if it was leaked. How do I know that? My husband has never once reported to DCFS. Now, we've hardly spoken to DCFS. This is the first time since Ms. Harris has been secretary, actually the second time. We went through the previous secretary to try and get the child picked up and this investigated. They went out to pick up the child, and the perpetrator refused to pick up. What they're supposed to do at that point is they're supposed to turn around and do something about that. They're supposed to go through their own legal department. That never happened. The then secretary, Terry Ricks, came back and said, I'm sorry, we don't have the power that you think we do. And my response to crickets was, if you don't have the power to do it, who does? So this child has not been interviewed. She potentially has been interviewed because the perpetrator has a long drug history, and he's now fallen off the wagon. I've had to hire, because I can't report this to police, I've reported it to the DA, I've reported it to the FBI, I talked to the criminal corruption unit, I spoke with an agent, And what she said was, she said, listen here, Dr. Trotter, you got to understand something about the FBI. We can't just invest. I said, I just handed you proof that a child sexual abuse investigation was falsified. She said, listen, we can't investigate anything without the U.S. attorney. I said, well, go and talk to the U.S. attorney, please. No response. Now, there have been a number of people I've talked to. The number of people that I've spoken to about this is insane. And one thing I will tell you, so when I hear about, what's the senator? Basically, when I hear about him and the Ezekiel's law, basically what he's saying is there's no communication between DCFS and police. That's correct. What I want to know is when I filed a mandatory report, and I've done it more than once, where did it go? So they knew, DCFS knew that I was going out to that police department to file it. They had it. They told me to go there. Now, at what point does this ever get followed? It got dropped. In April of 2024, I got a call again from DCFS, and it was somebody else had reported him. In court, he asked me if I knew that person's name, if I knew that person, and he knew the name of that reporter. Because they asked me, don't you know a Monica from Auctioner? I said, no, I do not. I didn't put anybody up to go and tell. Where is that report? So the problem is that there are no protocols. Why in 2003, and I've already testified about this, when I went looking, it's quite right that our state's down at the bottom. When I went looking, what I did was I'm an evidence-based practice practitioner. I went and I looked at who's the best in the world. There's 4 that are best in the world, and I went and looked at some of their plans and policies, and I put together a document that's a trauma-focused investigative protocol. And I'd like to try it, please. Nobody wants to do it. Nobody even wants to try it. I've sent it to a bunch of people who are experts in the field, and they're like, this is the most comprehensive questionnaire I've ever seen. You know why? Because I took DCFS's information, I took the best in the world's information, I went and did all of the research from the Department of Justice and everything that I could find online, and I put it all together in a nice little package for them. Now, in September, this same child showed signs of trafficking. She had a nervous breakdown with us and eventually told us that she was too scared to tell what was happening to her. And when I asked her very quietly, after she was having a complete meltdown, an episode of PTSD, she said her daddy was making her do bad things. I reported that to DCFS. They tried once again. So there was no, you know what's supposed to happen? What's supposed to happen? They're supposed to go out there, get an order, go pick up the child, bring her, and I requested, and it is my right to request this, I requested that she go to the best in the state because I didn't want anybody to be messing around and fooling around with it. I requested a psychiatric exam, and Kathleen Ritchie helped me with it. I called her, told her what was going on. Kathleen said, yes, this is reasonable. This is what you request. 7 weeks later, the child was not interviewed yet. Now, we're now back in court again. We are now $300,000 into this. I have 2 investigators that have basically talked to people within the community. They know that she's not doing well. The school knows that she's not doing well. And because police and politicians, so there is something so wrong with our system that somebody can get away with filing a falsified police report, Number one, that's my number one question. So you can have all the meetings in the world, but I can tell you the first thing that needs to happen is you have to have protocols. In 2003, the federal government put some legislation out that required that we have these multidisciplinary teams and all of that. We're not following it still to this day. And a friend of mine has actually talked to somebody very high up, and she said, we're not doing protocols. My response to that was, why are you not doing protocols? It's in the children's code. You have to have them. That's the first thing. That's the communication piece. So I will do protocols for you. I'll help you. But that's got to happen. And there's got to be a tracking system for, I don't know if you're calling it a dashboard. And I apologize if I'm coming off as being really angry, but you cannot believe what we've been through. There's got to be a system where police cannot do that. And it's happening. And I'm telling you that now because I lost my job over this. I was the manager of clinical research quality at LCMC. I asked for a protocol. I didn't ask for any HIPAA information. I called the Baton Rouge Children's Advocacy Center and asked them, who fills out this form? She said the person whose name was on the form wasn't the person who filled out the form. So I asked her, where are the protocols? And she sent me over to LCMC. I went over to Manning Children's and asked them for the protocols and told them what was going on. And they went back and forward with the Baton Rouge Children's Advocacy Center. And I said, listen, first of all, he's not supposed to have these records. So how did this get out? And secondly, these are falsified. This went on for 2 months. As soon as I said in writing, I jokingly said to the person at LCMC that I was dealing with, and she knew there was something wrong. As soon as I said that to her, she said, I'll forward it to them. I said, do I have to sue these people? There was no threat. I immediately got fired. And how I got fired was Our Lady of the Lake, who I had spoken to a nurse practitioner there who had done a non-physical, non-forensic exam, and I wanted to tell her she's not supposed to do that. So it wasn't anything I was going to do her. I got fired. I was a stellar employee. There was no reason for me to get fired. Still to this day, they have to know that there was never any interview at the Baton Rouge Children's Advocacy Center, and nobody's done anything. So my ask is that this honorable group of senators do an inquest. And I think what will help you tremendously, you have to do a root cause analysis. You've got to pick a few cases. You've got to do a root cause analysis and find out exactly where those breaking points were. And then what you do is you find the commonalities. So this is what I did for a living, right? Quality risk management. And quality risk management is basically the old-fashioned way. It's the newfangled term. But the old-fashioned thing is, what's going to kill you first? What are the worst things that you have going on first? And you develop a program to knock those things off. If you can do that, you'll really dramatically improve things quickly. You will, I promise, because it's impossible not to. And you have to have, one of the things that I keep hearing is nobody knows anything. There's no data that's being collected. I can tell you, I know that the initiative that they have about homeschooling, that's probably true. Children are more likely to be homeschooled and abused at home. But they're not going to win it because they never have. The Homeschooling Association in the United States shuts it down regularly.
Thank you, Ms. Trotter. You've given us a lot of information.
Yeah, I'm going to stop
today.
Now. Yes.
Like a lot. I appreciate your input.
Thank you.
Let us digest what you just provided to us. Mm-hmm. And thank you for your testimony.
Thank you. And I'm sorry I go on because
Don't apologize.
this has been a terrible situation.
Yes, ma'am. No need to apologize, and I'm sorry that you've gone through what you've gone through. Did you have something you want to add? Okay.
Terry,
Senator
just a
Andrews.
request, you don't have to come back to the table. I do want to discuss with you and Senator Barrow, and then the doctor brought it up, and it was on my list. You see me writing, I'm trying to keep a list. I guess I'm not as young as I used to be, so I'm keeping a list this session. And about the homeschool situation, that has come up in education. These issues sometimes cross committees in years past about some type of health and welfare check, not on every homeschool student, but I think you've probably, in your testimony today, narrowed it down to where I've never heard it before, when there has been an investigation or if there's an active investigation. Following through with that, just that small segment of homeschool students would be great. I want to hear more about that when you meet with Senator Barrow. Thank you, Mr. Chairman.
You got it, Senator Andrews. All right, Senator Barrow, what we talked about
Yes.
a while ago was to have you and the secretary's team, other folks who have provided input, other stakeholders.
Yes.
We've got a couple of different legislative vehicles here that we can work with, that you can work with over the next 12 days or so.
Yes.
Prior to the deadline. And Secretary Harris, please get with Senator Barrow, make progress, and bring us some legislation that is meaningful, that deals preferably in the response avenue, so that we can ensure that we can mitigate the loss of life for these children over the next 9-10 months and moving forward into years and years past, or future, excuse me.
Yes, we will commit
I have your
yes.
commitment to do that.
Absolutely, yes.
There's been a lot of meetings and a lot of talking and a lot of discussion. We'd like to see some action in this area. Okay.
Absolutely. And Mr. Chairman, I do look forward to working with the Secretary, her team, and any other stakeholders. There are individuals that I'm sure are listening. If they would like to be a part of some of these conversations, I invite them as well. Because when you talk about, there are a lot of different individuals. There are a lot of different pieces. Law enforcement is one component. The judicial branch is another component. And I think we all have to be at the table together, working towards a solution that works. I was looking back, this department was created in 2003, so it's been 23 years. And in 2009 through, I think, 2012, many of you guys may remember Joe Harrison, but he attempted to actually break this department off again, or yet put it back under LDH, which at that time I think was DHH. But at the end of the day, I am committed. I know that you guys are committed. And what I don't want is I don't ever want to give an account for knowing that something was wrong, something was broken, and I did nothing to try to fix it. I don't never want to have to answer to my God and know that I had not done everything I could possibly humanly do to save the lives of these children. We have no idea how many of these kids are going to bed at night crying, hoping that somebody comes save them. So I want to make sure that we're doing our part to save them. And I do want to give this report, because when the secretary sat down, she told me they had found the young lady. Thank God. Hallelujah. And she's still alive. But she has been raped. So we still need to continue to pray for her, pray for her family. We know that mental illness is already an issue. And I'm praying that whatever support that she needs, her family need, that the department's going to work towards it. And as we're looking for solutions for children like her, that we will be looking at what we need to do on the front end to minimize, as you stated before, Madam Secretary, we are trying to actually minimize, cut this off, and actually be an intervention and prevention rather than reacting. So with that, time has been well spent. I do thank this committee. I am going to ask that you guys do not take any action on this bill today, and we will come back within the next 12 to 14 days with a possible solution as we're working towards figuring out what's going to be best for this department. And if we are unable to achieve that, going back to your comment, Senator Andrews, then I will move forward with the bill as is.
Thank you, Senator Baroow. And I would like to make a comment to the employees of DCFS who,
thank you.
The morale is low, and we understand why, and the job is hard enough, and there has been discussion over this looming legislation and what it could mean for their futures. I hope, and this is, this might be hard to digest, but I think I can speak for the entire legislature when I say that we have your back as employees. You have the most difficult job in the state, and we want to make sure that you know that the legislature, the governor's office, we're here to support you. And so if you could take that message back to your employees, Secretary Harris would certainly appreciate it, because without them we're lost, and so we need them to understand that we've got their back. Okay.
May I ask that you can confirm the legislative fiscal note did come out this morning, and it notes that there would be efficiencies and reduction in staffing. And so we can say there's no intent to do that. Yes.
Oh, I was a little confused on that for a moment. Yeah. You talking about on my current bill?
Yes.
Oh, okay.
Yes.
What's that? Yeah, the reduction in staffing is in the executive office.
Not your staff.
No, it has it in child welfare and child support as well. The paragraph on child support and child welfare, it said that staff would be reduced through removing duplication of services. And so I've communicated to my staff that in the meetings that we've had, that it's been the position of the legislature that we need to invest more in the staff and not less.
Okay, yeah, go ahead, Senator Andrews.
I know I'm crossing committees, but Madam Secretary, we went on the record in Children and Family Services, in Select Committee on Women and Children, that we wanted to see what you needed so we could help provide it. There is no intent of this member, I believe, nor myself or any other member on this committee, regardless of what the fiscal note says, to reduce staff. Because we understand the truth is that staff is needed. Our question has been, do you need more staff?
Yeah.
And so I think that you can, I speak for myself and probably everyone on this committee, we're not looking to reduce staff. And then secondly, you can reassure your staff that Senator Baroow is sitting next to you and has expressed a willingness to work with you and not run this bill. Well, let me say in its current form. Most likely it's going to be a substitute bill that you will be at the table crafting that bill with her. If you all as a department does that, if you do that in good faith, you can reassure your staff that you're doing a bill in good faith that will substitute this bill, but also that this legislative body is not trying to reduce your staff. To the contrary, and I think you received an email or you already from my staff asking for an updated budget request of what you would need to protect our children. And if nothing else helps, you can show them that email, right? And I'm sure a number of your staffers are watching, because if my job depended on being an employee of DCFS and this bill was coming up to abolish or to move DCFS to another department, I would be watching the entirety of this committee.
Yes.
Thank you, Mr. Chairman.
And on that note, Mr. Chairman, if I may, just say one last thing, because I'm glad you brought up the staff. I did have notes here to mention that. I stated early on that I know that there are great people that work there, and certainly it is not my intent at all to actually reduce or to actually have people lose their jobs. As a matter of fact, that's one of the things that I struggled with even in bringing this bill. But at the same time, I want to make sure that we're taking care of our children. But I want to make sure that we are really looking at it structurally as well, because as I have begun to look at the department, I want to try to make sure that everything is really lining up, that it's apples to apples and not apples to oranges in terms of how people have their assignments. And I'm going to ask the secretary, because many of the people that work there have not had the courage to come and mention ideas and suggestions that they may have to her, may have for her because of fear of retaliation. But I think that there's a lot of value that you can glean from people that are there. So I would ask that you figure out a way to do that, maybe anonymously, so that people will come forward sharing things that you will never know, because you can't be at all the offices. That's near to impossible. So I would encourage that as well.
Good suggestion, Senator. Senator Cloud?
A quick comment. I know, Secretary Harris, you were supposed to be in Washington, D.C. reporting to our federal partners who help fund DCFS today and tomorrow. You had that scheduled since last week. And when you heard about this hearing and this getting scheduled, you canceled everything to be here to represent the agency and the well-being of the children. I just want to thank you for that.
Thanks, Senator Cloud. Okay, we've had a long hearing.
Yes, thank you. Thank you so much for your attention to this bill, and we will be back in a couple of weeks.
Thank you, Senator Baroow. Thank you, staff, for putting this together, and thank you, members, for participating.
Thank you, staff.
We have a motion by Senator Andrews to adjourn, and we are adjourned.
Okay.